is you put a little bit of volume here, a little bit of volume here. I would also suggest a little bit of volume in here, and potentially something back here to give you a bit more, because what happens when we get older is you lose the volume, but you kind of lose the volume almost from here in an arc all the way down here. So you'll have lost considerable volume by now. And in the past, we can just put in a little bit of volume here, but I actually think we need to think a bit about kind of creating a bit more substance around the angle of the jaw. My name is Leslie. My profession is I'm a clinical researcher, so I work within the NHS. I came across the Light Touch Clinic kind of by accident. I wanted to have something done, and like fillers, and I was very nervous about it, and I just wanted to come along and have a chat. I didn't want to have anything done straight away, but Dr. Natalie was absolutely brilliant, put me completely at my ease, and I ended up having a treatment on that very same day, and it was absolutely fine. It was great. It wasn't painful or anything like that, because I was obviously a little bit worried about needles and things like that, and I've since come back and had other things done, sort of like some Botox and the emerald treatment. So what we're doing for my patient here is we're going to put in a little bit of dermal filler. Now, when we're talking about dermal filler, people get a little bit anxious and think it's all going to be big cheeks, big lips, and look very unnatural. But in actual fact, what we're going to do is just replace the volume that has been lost, which is all part of the aging process. So here you can see there's a little bit of volume loss, mainly here, because you've got quite nice volume here. So there's a little bit of an arc going on here, and when you lose the volume here, it can make us look quite tired. So we're going to put a little bit of volume back into here to round that cheek out. And then when we've done that, we're going to follow this round and create a little bit of a lift here as well. So that's what we're going to have here. And we're also going to put a little bit of volume in here just to keep the chin area strengthened. And when we've done that, we might think about doing something here and here. But the aim of the game is always to look natural. I've only had the fillers once, so I'm coming back today for a top up. And Natalie was saying that sort of like just come back between 9 and 12 months. And so I think it's probably coming up about 11 months now. I wanted to have it done because getting a little bit older and things like that, and starting to see wrinkles and things like that. And I just wanted to kind of refresh myself. And what was really important to me was that I didn't want anybody to know I'd had something done. It's absolutely fine. I happen to have the day off work anyway, but I think I could have put some foundation on, gone straight into work, and nobody would have noticed. And the same with the Botox. Sometimes you get a tiny little pinprick type bruise, but you can cover that up with foundation. And again, that's the great thing, is that it doesn't take up more time than it does to actually have the treatment itself, and then it's straight back to normal. Yeah, I'm back to work, and if you're busy in work and things like that, it's great. I'd had Botox previously, but it was the fillers that I wanted to come for, and the emerald. Actually, it was cool sculpting first of all that I looked at, and that's what probably brought me sort of like when I was doing my search, brought me to this clinic. But we ended up changing from cool sculpting to the emerald. It was just to help a little bit on the last part of my weight loss journey, because I have lost quite a lot of weight. And again, when you lose weight, then your face changes a little bit, and so the fillers were kind of like plump my face out a little. And then I asked about the Botox, and Natalie said she could do that as well. Oh, most definitely, yes, without a doubt.